COVID-19, but that's really an unfortunate circumstance.
Well, with them and meetings with them have been challenged, and many of my colleagues, unfortunately, and I've mentioned this before in the past, will suffer PTSD from the situations they have faced on too many occasions, attempting to help those patients out. And it has not been at all an easy task for the healthcare professionals. But when it comes to patients themselves and the families as well, it's so important. It's so important that in this time and a threatening time that we know what our options are. And unfortunately, the older population faces sometimes the numbers statistically show that the highest morbidity are in that older population. And of course, we're changing that a little bit now for the better, but it's still, that threat is there. But it's so important, Dr. Kalani, for people to understand and communicate with their family, their healthcare professionals, what they want, to make sure that they have power of attorney designated, that they have advance directive. And so that discussion is so important to have for our patients in Santa Clarita and everywhere where those who are listening to this program. So tell us a little bit about that, how it's important that individuals are mentally prepared and have made this discussion with family members.
Yeah, so actually, just even in regards to COVID-19, it's really important to have good and really, honest conversations with your loved ones, regardless of age, but of course, focusing on our very vulnerable population of our seniors. And one of the things that has been so tremendous is the development of advanced care planning, living wills, to help really direct your loved ones as to how best to care for you in case you lose the capacity to make decisions for yourself. Because what we're seeing with COVID-19 is it's not just a respiratory illness. It actually can make you very confused. It can put you in a situation where you can almost go into almost like a comatose state. So we're seeing different levels of mentation. And so then the doctors and nurses aren't able to communicate with the patient directly. And if we're not able to listen to our patient directly, we're going to rely on their loved ones to make decisions for them. So it's really up to our seniors to have those conversations with their loved ones and have it documented in the form of a living will and a durable power of attorney, so that we're honoring who they are as people and what their lives have meant to them. Because the fact of the matter is at this point in time, regardless of whether you have COVID-19 or you have some other illness that brings you to the hospital, your family members are not going to be there at your bedside right now because of this pandemic and because of the restrictions on visitation. So you're going to need to advocate for yourselves in advance and let your family members know how you want to be cared for. And it could be as extensive, I want all sorts of life-saving treatment done. Whatever that may be, I find that that's important to me. Or it could be, if I'm not going to live the life I'm living now, then that's not for me. I don't want those levels of treatment. There are lots of resources that we have available, and actually Providence has a pretty extensive packet for advanced care planning available that can be provided to our community to help really guide them through the decision making around their advanced care planning.
That's a good thing to have. It really is, Dr. Lee.
Yeah.
It's interesting because my kids had always said to me and to my late husband, you need to get a trust, you need to have health care directives so that we can come in if necessary, step in and take care of you. And also, much against my deceased husband's wishes, I got us long-term care insurance.
Well, that was wonderful for you guys.
It came in handy because Russ needed it. I could not take care of him. I got someone in overnight at first, and then when I could no longer handle him during the day, I had someone come in on a 24/7 basis. And it was amazing because that long-term care insurance covered 2/3 of the bill.
Oh, wow, that's tremendous.
And you know yourself, being a doctor, what home care costs on a 24/7 basis. I mean, it is very, very, very expensive. But we were able to do that, and until he had to go into the hospital. And bless his heart, he's in a better place now.
Yes.
But he was well taken care of. And did you know also that Carl is in the hospital?
No.
Carl Goldman.
Yes.
No, he's back in the hospital?
Yes. He's been there for 3 weeks now.
Where is he at?
Henry Mayo. I saw Jerry a couple of days ago, and she's not allowed to visit him.
No.
Which is,
gosh.
Well, he's in the, he had COVID.
Yes.
He caught it.
They were followed his journey quite well.
Yeah. And he has not really significantly recovered from it. Plus, he has a couple of other things that he's been troubled with. But when I saw Jerry a couple of days ago, she said he'd been in the hospital now for 3 weeks.
Oh my goodness.
Yeah. Well, of course, our best goes to Carl Goldman and Jerry Goldman. And, when we come back, I think this is an important part of this conversation about the restrictions that all families and loved ones are facing with hospitalization and not being able to visit their loved one. And this is an ongoing topic, and I kind of want to see, the role in terms of palliative and end-of-life care, where we go with this. So let's come back and
let's talk about it.
Let's come back and have that discussion. We're talking with Dr. Marwa Kalani, who's a palliative care physician at Holy Cross. I'm Dr. Gene Dorio with my co-host Barbara Cochran on your hometown station, AM 1220 and 98.1 FM KHTS.
If you're in danger of losing your home to foreclosure, you need an expert. Hi, I'm Rich Sherman with Alta Realty. I've helped hundreds of Santa Clara residents save their homes completely for free. I've got just over 20 years experience and a loan modification success rate of over 80%. I can negotiate better terms with your bank, and I can save your home from foreclosure. And again, we do this completely for free. So if you're in any danger, please call me today at 661-714-1400. That number again is 661-714-1400. I'm Rich Sherman with Alta Realty, and I'll be happy to help you save your home for free.
At College of the Canyons, we are
an inclusive community,
a family,
a partner,
a leader,
a way forward,
an open door,
an affordable education,
an opportunity for a different tomorrow.
Fall classes begin in August.
The time is now.
The place is here.
Enroll now.
Canyons.edu/schedule.
best live theater can be found right here in the Santa Clarita Valley. The Canyon Theater Guild has been entertaining audiences for decades with top quality musicals and plays. Located on Main Street in Old Town Newhall, CTG also offers workshops for the young actor in your family. For more information, call the box office at 799-2702 or go online to canyontheater.org.
At Advanced Audiology, we know how important hearing is to you, your loved ones, your work success, your safety, and your ability to stay in the game. Most people won't admit hearing loss to themselves or others. We make it easy for you. Today's digital hearing aids come in a variety of styles, including invisible. All feature-rich, providing unparalleled hearing quality, wearing comfort, and automation that simplifies your life. Don't be fooled by our imitators. There's only one Advanced Audiology with the purple sign next to AAA on Valencia Boulevard.
My tile is 20 years old, and it makes my house look 20 years old.
For quality, custom kitchen, bath, and tile, trust the professionals at Southern California Tile.
Hi, I'm Bob of Southern California Tile, and I invite you to come look at the wide selection of tile and stone at our showroom. We offer you personalized one-on-one service and help you see the many beautiful possibilities for improving your home.
Get some style at Southern California Tile.
In Placerita, by the entrance to Masters College.
Loss of hearing can affect the quality of life. Santa Clarita Hearing Center can help. They specialize in both preventative hearing loss and corrective measures, including diagnostic tests, new technology hearing aids, cochlear implants, hearing protection, and tinnitus treatment. They can adjust your current hearing aids or fit you for new ones. Santa Clarita Hearing Center also offers sleep molds, swim molds, and musician monitors. Book an appointment today. Log on to SantaClaritaHearingCenter.com. Located on McBean Parkway next to the hospital. That's SantaClaritaHearingCenter.com.
Your hometown station.
Will you still need me? Will you still feed me when I'm 64?
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, 98.1 FM, AM 1220 KHTS. And we're speaking with Dr. Mawa Kilani, a palliative care doctor. And Doctor, we discussed during our break about visits to patients in the hospital. There's such a restriction now because of COVID, but there are other patients in the hospital that are there for different reasons. Mm-hmm. Like, as we discussed, maybe end of life. Are they not allowed to go in and visit their loved ones also?
Well, we actually have a pretty well-developed end-of-life visitation policy. We're actually meeting this afternoon to further enhance that policy. Mm-hmm. So we had a 2-person limit visitation for our end-of-life patients, for non-COVID patients. And we are planning to expand that where we can rotate out those 2 individuals with 2 other individuals, but it has to be immediate family. Yes. Now, in regards to our COVID patients, we're working on, again, we're going to be meeting later this afternoon. We're trying to work on a visitation policy as well, where we can enhance that visitation for our COVID patients and families. We're thinking if we can garner PPE, the personal protective equipment, for our patients. It will be provided by the hospital so that our 2 family members could come and visit with the patient that is dying. So as you can imagine, we've had a lot of patients here who have died with our staff at their bedside, not their family members, but our hospital family, basically.
And to be honest with you, I have a lot of problems with that policy for all hospitals in the United States and around the world. And we can understand that, this virus, is a terrible thing. And if you get it, you could be in trouble. So, everybody's got to be protected. Yeah. But I do feel that there are ways for us to be able to allow family members to see their loved ones. And the PPEs, I think, was the biggest obstacle, to be honest with you, because I don't think they said that. Any hospital said we don't have enough PPEs, but in terms of protecting the supply of PPEs in the hospital setting, they had to do something. So one of the things was to keep those family members outside the bounds of the contamination. From contaminating or getting contaminated, I think they wanted to assure that it wasn't being spread from the hospital, which is very, very understandable. But now that we have better control, I think it's important that we start utilizing PPEs, and we still don't have enough PPEs. And certainly if there's somebody out there listening to the show, one of the fundraisers that people can do is providing PPEs to family members who might be at end of life, and doing donations and setting up programs that provide PPEs so that patients can be visited. To hold one's hand, to be held, is so important psychologically. For many of the patients who have gotten through it, holding the hands of healthcare professionals made a huge difference. But for some that didn't make it, some of them may have, if they had their family members there, may have made it if the family was there. So, tough call, but, maybe like you guys are doing down at Holy Cross, and I know they're doing it at Henry Mayo as well. So I'm sure hospitals around the country are starting to think about bringing back visitation. So I'm glad you guys are doing it, though.
Yeah, so most recently the Daily News featured our hospital staff in a really beautiful expose of how we've been dealing with our COVID patients, and in particular one of our chaplains was interviewed, and the way that she channeled that spiritual energy from the patient's family through an iPad, because we're doing extensive virtual visits, but channeled that energy through the iPad, through her hands, her healing hands on the patient.
Oh, wow.
Oh, my God, it was so beautiful. And I see this every day with our chaplains. I mean, we are so fortunate to have such an amazing spiritual care department, and I think that's what's gotten us through these last 4.5 months, frankly. And I keep telling them that. I said, and I celebrate them every week. We do something special because they are exceptional people.
Wow.
Well, that is so important on an emotional level also.
Yes.
Not only a physical touching, but emotionally knowing that somebody's caring for you, emotionally and physically caring for you by holding their hand. It's so very, very important.
And the families are seeing it on the video, on the iPad. So they are witness to the care that we're providing, and the patient is hearing their loved one's voice, and it's as best as we got. But again, we're still trying to work on expanding that so that we can get some visitation going. And of course, once we know more about COVID, it can only get better from here. I mean, I don't think things could get worse, can they?
No, it's going to get better, Dr. Kalani.
I think it's going to get better.
Yes, we have to think positive and work positive and look toward the future. The past is already gone. We don't want there anymore. We're looking forward to everybody getting better, staying healthy, and having the people around them, like the people at the hospital, like you, who can comfort them and say, this is going forward now.
Yeah. But I do have to share, we've had some pretty tremendous successes, too. We've had some really beautiful situations where patients have left here and have been cheered on. We actually have a special song that's played for every COVID patient that gets to be discharged.
Oh, wow.
So we play Here Comes the Sun. The Beatles song.
Beatles, yep.
Yeah, and so for every patient, that song is played overhead when they exit the building.
Wow.
Wasn't there a picture?
Beautiful.
Doctor, wasn't there a picture in the paper like that?
Yes.
Yes, we saw it.
Yeah, it is just so wonderful. So we're
and it mentioned that the song was playing. It was an article in the Daily News, I believe.
Yes. They've featured. They've come in and been with us quite a bit to really capture what we've been doing here. And I know Henry Mayo is your local hospital up there in Santa Clarita, but I'm going to tell you, Holy Cross is something special. It is a unique hospital.
That's what I've always been told. And many of my friends who have been hospitalized have chosen to go down there rather than go to Henry Mayo.
Yeah.
It's been amazing. It's been absolutely amazing. But the articles in the newspaper have portrayed those pictures of those people leaving, and it's encouraging. It really is.
Well, it's not just for the patient.
No, it isn't. Absolutely. It's for everyone.
Need it.
Yes. The public needs to see something like that, and that's what's so helpful. It really is.
Yeah, we're trying our best because it's been brutal. It's been brutal.
Well, we have to have that positivity, like Barbara is saying, come back. We have to have in the community a sense that there's a light at the end of the tunnel, and when that light happens to be Here Comes the Sun, it does help us feel that we're moving in the right direction. Every day you hear about the possible vaccine. Every day you hear about potential antibodies and treatment with that. They still talk and hope that the convalescent plasma will make a difference. And, around the world, as well as in our country, the doctors and medical professionals have come together to collaborate with doctors from Wuhan, China, doctors from Italy, doctors from the East Coast. Some of the doctors from the East Coast actually are traveling to Florida, to Texas, to Arizona to help the healthcare professionals in those arenas to help their communities out. So it's a nationwide thing that's going on. And when you say, here comes the sun, I can see it rising.
Yeah.
So it's
inspiring.
It's inspiring. So we have to keep hope. We cannot give up. We know that the numbers seem to be slowly stabilizing as of yesterday. But I look at them every day and isolate certain ones that I know are important to our senior population and hope that they will continue to improve and get better for all of us. And I have had COVID patients, and just to mention, to give people hope, I had one patient who is COVID positive, was in isolation, never had to go to the hospital though, but she survived, and she did okay, but she's 99 years old.
Wow.
And she has made it through. And so you have to say, okay, talking about hope, it is there. If you do the right things and help out and keep people, do simple things sometimes in terms of prevention, in terms of wearing a mask, in terms of distancing, washing hands, all the simple things. But then in isolation, staying hydrated, keeping your nutrition level up, and helping them out make a huge difference. Survival is is it's a team event. And when you have the doctors and the nurses and the respiratory people and the staff, it makes a huge difference at every home, every nursing home, every board and care, every assisted living, and every hospital. To work, people are working together, and I'm very proud of our profession that we have done this. And so we have to continue doing this. I was taught as an athlete, don't spike the ball on the 5-yard line. And all it means is that you don't give up. Yeah. You don't give up. And I know that I have lived my life that way, and I just tell people right now, don't spike the ball on the 5-yard line. Let's keep going. You know, we can get control over this. Other countries have done it. And we can do it too. So here comes the sun.
Here comes the sun. Here comes the sun. I'm telling you. So yeah, it's been an amazing experience. It's very stressful, sometimes emotional for our staff members too. But it has been a journey.
Yeah.
Well,
but you know,
Jean, I hope you're going to be around when I'm 99.
Yes.
Well, I'll be pretty close behind you there, too.
Not far behind.
Yeah, they'll be saying about me, they'll be saying, here comes the moon. Who knows? Who knows?
Oh, dear.
So,
I'm going to beat you there.
Yeah, it's a race, but, you know, as long as we're, you know, supporting each other, as long as we're helping each other out. And, you know, sometimes I get upset with certain people who are using this as a moneymaker for profit, politically or whatever it is, when all of us are struggling. You know, all of us are playing our role. So put your heads down. Don't give up. Don't spike the ball on the 5-yard line. Move forward. Because we will persevere, and we will achieve, and we will survive.
Yes, I know, and it takes a positive attitude to do it. You've got to think positive.
Yeah,
I strongly believe that. And I'm a positive person, and I'm going to stay positive. It ain't going to get me.
Well, you know, one of the things when we come back from our break, one of the things that I think for our seniors is that, you know, they're afraid if they go to the emergency room and it's crowded and ventilators are being used and we don't have ICU beds and blah, 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 that they'll look at our gray hair and they'll say, this person's old and they don't get a ventilator. So let's talk about
let's talk about that.
Let's talk about prioritizing, Dr. Kalani, because, you know, this is something that is not easy, and I just don't think that it's fair either for youngsters to be walking around without a mask and grouping together, not keeping their distance, but yet when they if they should get ill and there's a choice to be made, people who are irresponsible, who've gotten the disease and maybe could have prevented it, are taking the place of someone who might be older but still wiser in terms of their experience. And
Absolutely.
You know, I think that issue is out there, and our seniors are worried about. So we're talking with Dr. Mawa Kalani, who's a palliative care physician from Holy Cross, Providence Holy Cross. I'm Dr. Gene Dorio with my co-host Barbara Cochran on your hometown station, AM 1220 and 98.1 FM, KHTS.
This is Bradley Gross from Santa Clarita Grocery. Santa Clarita Grocery serves fresh groceries to families, individuals, and those experiencing homelessness. At Santa Clarita Grocery, out of every dollar donated, a full 99 cents goes directly to the needs being addressed. As an all-volunteer-led organization, we operate on a 1% overhead, receiving no government funding for our operations in the community, resulting in us being one of the most efficient charities in the Santa Clarita Valley. Valley. If you're looking to support the good for our community, please consider partnering with us by donating to Santa Clarita Grocery. What is donated is specifically kept in the Santa Clarita Valley, helping over 3,000 families, including 5 other community charities. Please visit our website, santaclaritagrocery.org, or visit us on social media or call us at 425-7575. That's 425-7575.
Hi, I'm Eric Goldhurst, Head of Operations for Burger King North America. Throughout this time, we've taken steps to take care of our guests.
And since we know many of your jobs have been affected by this crisis,
we want to help make sure you're taken care of too.
If you are looking for work, we are hiring.
And there's a spot on our team for you.
We know that we'll get through this together, as long as we keep taking care of each other.
For more information, call 253-3283. That's 253-3283.
KHTS strives to give the Santa Clarita Valley all the information they need. And when our computers aren't working the way they should, we call Resurgence, your true source for IT. Resurgence provides outstanding customer service while also providing the highest technical ability. They strive to do what's best to improve and protect your business. For more information on Resurgence, call 349-4114 or visit resurgenceit.com.
Social distancing slows the spread of coronavirus, so we should all stay home to lower the risk for everyone. More info at coronavirus.gov. Let's all do our part, because we're all #AloneTogether. Brought to you by the Ad Council.
Your hometown station.
Our news team at KHTS is constantly working to keep you informed. If you want the latest and greatest information on the Santa Clarita Valley, just sign up for the KHTS newsletter. SCV News delivered directly to your email inbox every weekday by 5 p.m. and a special weekend edition on Sundays. All it takes is an email address and you're set. Go to hometownstation.com to register.
98.1 FM and AM 1220.
Loss of hearing can affect the quality of life. Santa Clarita Hearing Center can help. They specialize in both preventative hearing loss and corrective measures, including diagnostic tests, new technology hearing aids, cochlear implants, hearing protection, and tinnitus treatment. They can adjust your current hearing aids or fit you for new ones. Santa Clarita Hearing Center also offers sleep molds, swim molds, and musician monitors. Book an appointment today. Log on to santaclaritahearingcenter.com. Located on McBean Parkway next to the hospital. That's santaclaritahearingcenter.com.
It's like no other station I've ever listened to. It's great.
Your hometown station.
Will you still need me? Will you still feed me when I'm 64?
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, 98.1 FM, AM 1220, KHTS. And we're speaking again with Dr. Mara Kalani, who is a palliative care doctor. And we have really covered some ground, haven't we, Doctor?
Yeah, so it's been a really fun time. It always is with you guys.
Even though we're talking about a serious, real serious dilemma and challenge that society faces, and of course our seniors face it as well. And you know, one of the big things that Dr. Kalani, that seniors are worried about is that their care might be prioritized and they might end up in an emergency room where they know they want to live. They know they want everything done. They know that if they're in distress and have to be intubated, they want to be intubated and be in an ICU. But, you know, there are certain laws that are out there that scare the heck out of many of our seniors, and it's called Crisis Standard of Care. And this has been mentioned in different newspapers and around the country that emergency room doctors have a right to make decisions, if they have to, in prioritizing who gets the ventilator and who doesn't. That's not I've worked emergency rooms. I know what it's like, but I certainly wouldn't want to be have to make those decisions. But if push comes to shove, I want to. But on the receiving side, if you're a viable senior and you know still have a lot to contribute, why shouldn't they have their right? And should our seniors be afraid of something like that?
Right. Well, yeah, it's such a complicated issue. On a national and federal level, that may be one thing, but I can tell you from the Catholic healthcare perspective that that's another. Because so Providence Holy Cross is part of a Catholic health hospital system. And we have had significant discernment in regards to anything related to providing care, whether it be ventilators or even the new medication remdesivir, for instance. We have done significant discernment and ethical deliberation around who is actually going to be receiving this, and even in the midst of a crisis. So regardless of age is not a factor when it comes to being provided treatment in our hospital. That's just the bottom line. That's the bottom line.
And, right now when it we have the capacity, and we're very lucky ones. Secondly, we are saving more lives and keeping people out of the hospital and getting them out a little bit faster, which is 2. So, but it's still, and now the numbers are tipping a little bit for the better, which is good. And so I don't want to say anything, knock on wood, but things are looking not great, but they're looking at one step better. We'll see what today shows compared to yesterday. But you still have to fear if people go a little wacko and they start not using masks and get grouping together, it could get worse. And this did happen because that's why we're having this surge. But I think that fear is there, and hopefully you're right. We just don't have to end up facing this because it's something that I think our seniors fear, that somebody and family members fear that, my loved one has gray hair and they're going to be looked at as someone being old, and they won't offer them the care that they should be getting. And that's kind of sad and difficult to understand in this country, that we should be having to make these choices. And, I hope my colleagues who have just withstood the emotional part of this don't have to make these decisions, because that really shouldn't be in our realm. If we're in a war situation, we're triaging patients. Sometimes you have to do this, but this is the only situation where I have been in where I think that you can make clear-cut decisions where you don't have to feel bad about that decision. So I'm hoping my colleagues don't have to face these terrible dilemmas in the future, nor do my family members or patients face it either. But it is one of these things that, as we prognosticate and look forward, think to ourselves, are we going to be faced with this? And it is a nightmare sometimes for all of us that we might be having this occur in our country.
Yeah.
So, but our duty and job is to allow our family members and patients make decisions. This is America. This is our right to be able to make worthy decisions for ourselves and the people around us. So this should happen, but palliative care helps a lot to be able to do that, doesn't it?
Yes, because we advocate for each individual patient. It has nothing to do with the age. It has nothing to do with the stage of the condition. It's about ensuring that our patients get the quality of life that they deserve. And if our patients want to push through and try all treatments possible to hopefully get them through, a COVID infection, for instance, then we'll be advocating for that.
Yeah, that's
the role of the palliative care team.
Yeah, well, congratulations. Keep up the great work. We appreciate everything you do for the Santa Clarita Valley and the patients that you care for at Holy Cross. This is not easy, but the challenge is there, and thank you for rising to the challenge. And as we all say, here comes the sun.
Here comes
Thank you
the
so much,
sun.
Dr. Kalani.
Keep up
Thank
the
you.
good work, Dr. Kalani.
Thank you so much, Barb. It's so good to hear from you.
Good to hear from you. Thank you. We are sponsored by Comfort Keepers In-Home Care, Advanced Audiology, and Santa Clarita Hearing Center. Listen to us next week on the Senior Hour. Now go and enhance your quality of life.